Okay, so this first segment comes from a recent influencer, which I'm going to ask you guys if you know who this person is. I bet Brenda might know. I doubt Danica knows. But she was open up about a recent surgery. So this is a segment about Brazilian butt lift reversal/reduction surgeries. That is the influencer. Of course, you probably can't tell from her butt. But this is about Anastasia or Stassi Karakanala. Do you know who that is?
I've never heard of that.
She's apparently BFS with Kylie Jenner.
I definitely have heard of her, but I don't really pay attention to her like that.
I hadn't heard of her, but I don't get into the influencers as much. I mean, there's so many out there. So anyway, she's 28-year-old friend, BFF, Kylie Jenner. She's got like 10 million Instagram followers. So she's like a legit influencer. And she had previously said that in the past she got pressured into having a Brazilian butt. You know Brazilian butt lift? You heard me talk about this, right?
Yeah.
Yeah.
How can you get pressured into doing that?
Yeah, that's what I was wondering too. And so on some podcasts, she just said that it was almost like this expectation of influencers to have a certain look. It's not like someone put a gun to her head and said, get this Brazilian butt lift, but just with her job as an influencer, she felt the obligation to get a Brazilian butt lift. And she's regretted the procedure. And so she wanted to see about if she could get it reversed or reduced. And she actually posted on Instagram this past week that she was recovering from her BBL reduction. But here's the crazy part. She said it was just her first surgery and she was going to have to go back for another follow-up surgery in a few weeks, which is kind of wild. That must be pretty rough if they're having to do for sure 2 surgeries. But I've talked about Brazilian butt lifts on the show a lot. I really don't like those surgeries. And it's not about the aesthetics, because I mean, the aesthetics I think is fine. Back when the Kardashian look was in, I thought the at least the initial look from these was great. But the reason I don't like them is because they do carry a dramatically higher risk of death, which is not something we generally talk about as a risk for plastic surgery. But Brazilian butt lifts do carry a much higher risk of mortality or death due to the risk of fat embolism, which is, of course, the Brazilian butt lifts, you harvest fat and then you inject it into the butt. That's the lift. It's really more of a butt augmentation. And if that fat gets into your bloodstream, it's a critically severe problem.
How come they don't just use like implants like they do with like breast implants?
That's a great question. I like that. So the reason is that the actual implants like that you would use similar to breast implants don't work well in the buttocks because there's a high risk of malposition or the implants getting out of place because you sit on your butt all the time. Like you usually don't lay on your breast that much except maybe when you're sleeping, but you sit down literally all the time.
Yeah.
And because of that, the risk of issues with the implants is very, very high. I would never, ever do an implant. I mean, I wouldn't do a BBL either, but I definitely wouldn't do a butt implant surgery. It's just not worth the risk and, issues with healing or implants getting
I can't imagine the healing process. Like, can you even sit down for like a month?
No, they would have people avoid sitting as long as possible. Like
I've never thought of that. That's crazy.
Yeah, I mean.
How do you sleep? Because I toss and turn. I want to be able to.
Well, you may not toss and turn if your butt hurts really bad.
That's true.
you might avoid. You may have to like stack pillows up on either side of
right.
But yeah, like actual real implants for buttocks are not really a thing anymore. I think they do them in some countries, but they're just so bad that even the bad plastic surgeons won't do them, which is that's a pretty bold statement. So anyway, yeah, the BBLs though, risk of fat embolism is there. A lot of the times when we talk about deaths on the show, when we're talking about plastic surgery, horror stories in the news, almost all of the deaths are related to BBLs. There's other risks on top of that. The fat can reabsorb, it can scar, it can get hard. And so, I get a lot of people calling my office about Brazilian butt lift. I'm just like, no, I'm not going to do it. Like, I'm just not going to take on that risk for myself or for my patients. And I think that, I think enough news stories about BBLs has kind of gotten out because they are kind of trending down. They started to like pick up when they first came out and they've totally plateaued. And I thought this year might be the first year they'd actually go down in number, but it was basically exactly the same. So we'll see what happens next year. So let's say you did have a BBL and you didn't die from it, which is good, but now you don't want it. Is it possible to be reversed or reduced? And the answer is yes, sort of. It can be reversed, but it can actually be a pretty complex thing. And so, why would somebody want to reverse a BBL? I mean, two real common reasons. One is the change in trends of what's the ideal body. I mean, for the longest time, the Kardashian body was in.
Now it's like ballerina, right?
Yeah, right, ballet body. Did you hear me say that?
No, I just knew it. I'm on TikTok all the time.
Oh, wow, okay. Very good. Yeah, the ballet body is the current trend right now. I'm very impressed that you knew that. So changes in trends, more slim look, more athletic look is in. But then also changes in body habitus. And so what that means is as we age, the tendency is for us to gain more fat, unless you really are working hard to prevent it, which I'm trying to do myself. But the general trend is as we age, your body fat percentage starts to increase. And if you have all this fat injected into your butt and you gain weight, I mean, your butt can get like out of control. I mean, you can like end up with like a serious dump truck. And
Oh no.
yeah, it would be bad, right? And so, if that happens, somebody who, 10 years in the past or 5 years or whatever might have been okay with the size, suddenly it gets too big. So those are some of the reasons that people might want to reverse or reduce this. So how do you do that? Well, the obvious answer is liposuction. Basically that's how you suck the fat out to put it in the butt. So if you use liposuction, you can potentially get the fat back out. However, there's a catch. There's an issue when you inject fat into the buttocks with scarring. And even if it heals very well, which it doesn't always do, you can get really bad scarring. But even if it does heal well, like your fat tissue back there is not going to be like normal fat. It's going to be harder, stiffer, and doing liposuction is going to really suck. I've done,
That sounds like awful. How does it get
For the patient or
harder?
me?
For everyone.
Yes, I would agree for everyone. Yeah, I mean, I've done liposuction on people who've had previous surgeries. It happens from time to time. I mean, that somebody wants lipo on an area that's had an operation, whether it be previous liposuction or whatever, and it just sucks. Like, it's hard to get a really smooth result. I mean, it is doable, but it can be, not fun, which can make it more traumatic for the patient, more recovery. Sometimes you can potentially make it easier if you use some of the power-assisted liposuctions like ultrasound, but still it would be pretty crappy. There's other issues too, just like whenever you reduce fat from Ozempic or weight loss or lipo or whatever, you're suddenly going to have an issue with loose skin, and that can be a real thing where, yeah, you reduce your buttocks and the size isn't as big, but now you have like a saggy granny bottom.
Oh no.
Yeah, that's rough, right? And it's like you may have to like have another procedure to fix that, which may be what Anastasia or Stassi was talking about when she said she's gonna have a second procedure. So, it can definitely be fixed as far as you can reduce it. It's not simple. You definitely want to find somebody that does a lot of vision work if you're going to attempt that. And you're also going to have to realize that it may not be your only surgery, because it's going to be possible that even once the fat is reduced, that you are unhappy with the appearance because of the sagging skin, which is something when I do liposuction on patients, I always talk about. I'm like, okay, if you want to lipo your tummy, fine. Be aware your skin might be loose, and it may or may not snap back from the elasticity, and you may have to have another procedure down the road.
So wait, I just had a question in mind.
Did it escape you?
Oh, I found it.
Okay.
So, do you think it's more dangerous than a BBL, or is it like the same, or is it like less?
That's a very good question. So no, the actual first procedure is far and away the most dangerous, because the risk of death from Brazilian butt lift is if fat gets into the bloodstream, which the reason that happens is when you're injecting fat into the butt or wherever, you're using a needle that's attached to a syringe that's got the fat globules in it. So you're putting it in and you're pushing it. And so if that gets into a blood vessel at just the right angle or whatever, and you push a bunch of fat into the bloodstream, that's what's potentially deadly. But when you're pulling fat out, no. I mean, there are risks associated with just doing liposuction, but generally they're not death unless it's a very extreme circumstance. In fact, we've done a couple episodes where some plastic surgeon, or maybe not even a plastic surgeon, some non-surgeon was doing liposuction and like punctured the intestines or the liver.
God.
Yeah, it happens from time to time. I mean, it shouldn't happen to anyone who's good, but like there's a lot of people out there doing liposuction that really shouldn't be treating patients. But so to answer your question very specific, no, it's not near as risky to remove the fat as it is to put it in. When you talk about, being hard, it's more about just like, is it going to look right? Are you going to be able to get out as much as you want, or is it going to be a scarred up mess and you can't even get out as much as you want?
That's so scary to me.
Yeah, I mean, I think definitely when it comes to, reversing a Brazilian butt lift, this is definitely an instance of prevention is way better than the cure, meaning just don't do it. I mean, these are just bad surgeries. I know they're still mildly popular, although they're kind of waning, but there's real risks associated with them, and reversing them is not simple. I mean, like if you go get breast implants, and it's like, and I do these surgeries all the time where somebody has breast implants they don't want anymore, and so we take them out and we reshape the breast. I mean, it's very straightforward. I mean, patients do great, but reversing a Brazilian butt lift, not quite that simple, and could end up with multiple surgeries, and so.
I think it's gonna go down in 2026.
I bet it does. I mean, I think
Yeah.
there's two big reasons why Brazilian butt lifts should go down, and there's really not a ton of them done. For example, when you look at implant-based surgeries, I think it's something like 300,000 implant surgeries are done in the United States every year. Brazilian butt lift, I think, is like 6,000.
Really?
Yeah. So you're talking is that 2%? What's 2% of 300, Brenna? Is it 6,000? 6?
I'm not a math person.
I'm calling you the wrong thing. Pretty sure, yeah. So I think, let's see, 1% of 300,000 would be 3,000, so 6,000. So 2% as many Brazilian butt lifts as like breast implants. Why was I even talking about that? I derailed my own conversation here.
Because I was like, I think they're gonna go down.
Oh,
You're like,
right.
"There's
Yes,
too
we were
many
talking about the
reasons."
numbers. Yeah, thank you. Thank you for bringing me full circle. Yes, I think you're right because one, there's more and more news stories about deaths from Brazilian butt lifts that come out. I mean, I see them literally all the time, and we talk about them all the time. And then two is the thing that you mentioned, that the body style that's most popular these days is more of a petite look. So.
Yeah, I mean, like all over my For You page, I've never seen like, I don't know if I've ever been on the BBL side of like TikTok or Instagram, but forever I've just seen ballerina bods. So I'm surprised that they're like number 1 or number 2.
Yeah, that's been a thing now for at least a solid year, the ballerina body. And of course, not everybody does that. But when you talk about like influencers and celebrities and stuff, they're the ones more prone to kind of go along with whatever the current trends are. So.
Yeah.